Ms. Tina M. Patterson, president of the PuLSE Institute, Mr. Bankole Thompson, editor-in-chief, members of the board and the National Advisory Panel, distinguished participants, partners, and friends. Imagine a girl. She is 12 years old. She loves school and dreams of finishing her studies, finding a decent job, and starting a family when she's ready. Only now, due to COVID, her hopes are evaporating. Her parents are now jobless due to the pandemic, and many nights she goes to bed hungry. Soon she'll drop out of school to get married and lessen the family's economic burden. With no contraception and with no say, early pregnancy and childbirth, predictably her fate. Standing at the threshold of puberty, why should she have to face a lifetime of poverty, powerlessness, and missed opportunities? I know this girl. I've met her in many places, in distress situations all around the world, and I want her to have a fair chance in life. At UNFPA, the United Nations Sexual and Reproductive Health Agency, we believe that sexual and reproductive health and rights and gender equality are key levers to end poverty and pave the way for a world in which women and girls control their own destinies. That was exactly the consensus at the Cairo International Conference on Population and Development in 1994. That conference program of action is evergreen. It made clear that population is not an isolated variable for external manipulation. Population fundamentally is about people, and in particular, women's lives interconnected with their families, livelihoods, and the very environment in which we live. So now, some 25 plus years on, it's clear that that Cairo breakthrough on population and development has contributed to fewer people living in extreme poverty, fewer preventable deaths among women and children, greater access to primary education, and approximately 7 additional years of life expectancy at birth. And yet the stark reality is that we still have a long way to go towards a gender equal world in which every woman and every girl is able to fulfill her potential. Discriminatory laws, policies, and norms continue to challenge women and girls' bodily autonomy and limit their full access to sexual and reproductive health and rights. Indeed, the latest UNFPA research shows that only 55% of women globally are able to make their own decisions regarding sexual relations and contraception. We know that the ability to control decisions about one's body, including the number and the spacing of children, is a precondition for the enjoyment of broader rights and empowerment. Bodily autonomy supports women's decision-making ability. It strengthens a woman's ability to participate meaningfully in the economy and increases the likelihood of breaking the cycle of poverty. A woman who can say, "My body is my own," takes her own decisions about sexual and reproductive health matters. She's also significantly less likely to experience intimate partner violence, and much more likely to be able to identify how to prevent HIV and how to seek prenatal care. In the more than 150 locations where UNFPA operates, we're focused on achieving 3 zeros that make a difference to life chances. 0 unmet need for family planning, 0 preventable deaths during childbirth, and 0 gender-based violence and harmful practices, in which I will include child marriage and female genital mutilation as harmful violence against women and girls. And sadly, now COVID-19 is contributing to a surge in adolescent pregnancies. Early on, we warned that COVID would contribute to the spike in gender-based violence that we're seeing now, and other human rights violations that threaten to undo decades of progress for women and girls' health, education, and well-being. UNFPA now projects that this pandemic could lead to 15 million unintended pregnancies a year and 60 million more cases of gender-based violence. Women deserve better. Women demand better. Meanwhile, 2 million additional cases of female genital mutilation and 13 million child marriages are expected to occur by the year 2030, dimming the light and the potential of an entire generation. And even before the pandemic struck, the global lifetime cost in lost earnings from girls who do not complete their secondary education was estimated at up to $30 trillion. UNFPA's intervention to respond to COVID-19 focus on advocacy and programs for those most at risk. And as always in times of crisis, it is the poorest and the most vulnerable people, women and girls chief among them, who are the hardest hit. What COVID-19 has also done is to expose huge fault lines. Today, we're witnessing what years of structural inequality, racism, discrimination, and institutional neglect have wrought. Poor access to quality health care, chronic disease, economic hardship, unemployment, housing insecurity, and the list goes on. Everywhere around the globe, the pandemic is wreaking havoc in Black and brown communities, the culmination of years of discriminatory public policies, systemic racism, and marginalization. In the USA and Latin America, for example, it is afrodescendientes who are 3 times more vulnerable to contracting and dying from coronavirus and suffer from its economic impact. The intersection of gender and race compounds the challenges for women of African descent who experience disproportionately high levels of poverty and are overrepresented in the informal job market, too often without basic social protections, including quality health care. Black women are also more likely to be victims of gender-based violence and 3 times more likely to die from preventable causes during pregnancy and childbirth. So what changes this, dear friends? It's up to us to take action. Action to make vulnerabilities visible, and furthermore, a commitment not just to say, but to join hands and to do. For us at UNFPA, our actions occur in humanitarian camps, in villages and towns all around the developing countries. We show up for women and girls when they need us most. Staffing hotlines for a woman under COVID lockdown who needs to escape an abusive partner. For that expectant woman who urgently needs a midwife. And yes, for a 12-year-old girl who wants to avoid being married off and to pursue her education and fulfill her potential. I have to add that for actions to be grounded in solid data and to truly leave no one behind, data must be disaggregated. We have to ask the right questions in order to know. Data do help us to know what's going on, but we have to disaggregate by ethnicity, by race, by disability, of course, by age and gender, and other parameters of import. That's how governments and others can identify and reach those who are most in need, which is essential to ensure better decisions, better policies, and better interventions. As we respond to this pandemic, upholding the full rights of those who are greatest at risk of being left behind is mission critical. And I believe that it's only through dialogue with representatives of marginalized communities that we will find answers to address the complexities of the COVID-19 crisis. Grassroots organizations and activists are leading in advancing the rights of people in their communities and in raising the demand for services and systems to make sustainable change and to make meaningful change. As we grapple with the gendered dimensions of this pandemic, UN Secretary General Antonio Guterres is calling on the global community to put women and girls at the center of the response and recovery efforts for equal representation in all decision-making processes and positions. I am very proud to be part of the first gender equal team of leaders in United Nations history. Previous crises also show us that bringing women's voices to the table makes for a much more successful and inclusive response, and COVID has been no exception, with countries led by women outperforming others by a mile. Simply put, we need more women in leadership. As Maya Angelou said, each time a woman stands up for herself, without knowing it possibly, without claiming it, she stands up for all women. While equal representation may elude us for now, the historic elections of U.S. Vice President Kamala Harris and Costa Rica's Vice President Epsi Campbell Barr provide inspiration to all women and girls, and especially women of color. Dear friends, protecting sexual and reproductive health and rights is part and parcel of advancing gender equality. That will be key to getting us through this pandemic and beyond to build a more resilient future. I recommend 3 key investments to give us unprecedented opportunity in terms of action. First, investing in system changes to enable women and girls to make informed choices and exercise their rights at home, at work, at school, and in the courts. Next, we need investments to address the socioeconomic impact of the pandemic on women and girls with targeted social assistance programs. And third, to ensure women's representation in pandemic planning and in all decision-making. Inherent in this is seeing sexual and reproductive health and rights needs prioritized, even amid overstretched health systems and shrinking budgets. Upholding the rights of women and girls is the right thing to do. The evidence shows it's also the smart thing to do because every $4.60 invested in an adolescent girl's health and upliftment, including her avoidance of early pregnancy, will give back at least 10 times as much in benefits to society. A fantastic investment under any terms. Dear friends and colleagues, even now with COVID, I remain optimistic about the future for the world's 12-year-old girls. I am inspired knowing that human rights and justice give us the tools we need to fight poverty and make right the long-standing inequalities that this pandemic has laid bare. Only then can we create the pathway to a more healthy, just, prosperous, and sustainable world for everyone. Thank you, and I wish you a very successful forum.